what are the risks we are facing? Myself, I'm Dr. Govindaiah Yatheesh. I'm the Assistant Medical Director working at Apollo Hospitals, Bangalore. I'm responsible for mainly for medical services, the quality and the accreditation in the Karnataka region. So predominantly, I welcome all of you for this session with the intent of learning something. I'm also thrilled to share my experience on risk management with each one of you, so that we can learn from each other. First, let's talk about, is it healthcare, the hospitals are safe place? If you all of us keep our hands on our bottom of heart and talk, we say, it is not safe. We still say, whatever we do, it is still less. So in such kind of a scenario and situation where we are in, we constantly looking at, what needs to be done, what best system needs to be put across, why healthcare is not safe. So in this context, what is the importance of understanding that healthcare, running a hospital is a risky thing? We need to know what is about risk, why people all talk about across the world about risk in the healthcare. To know about that, let us go about the basics of risk management. To go with the basics of risk management, the first fundamental things one need to start is, what is a risk? Let us start with the definition of what is a risk. The definition of risk is considered as an indicator of threat, or it's defined as a threat, and it's also defined as vulnerability. It's also defined as impact on uncertainty. There are other couple of definitions which I have come across. This is what something which was very much impressed to me was, any uncertain future event or a condition which it happens affects the mission of an organization is considered as a risk. It can be risks, or either it can be a positive risk or it can be a negative risk. Always people take a positive risks as an opportunity. It if you take a positive risk means we are invested in a market share, the market has grown up, so that is called as a positive risk. If you don't take, you lost money, that will be a negative risk. The whole thing is, what we would like to say here is, one would like to take a maximum advantage is called as the positive risk, and at the same time, whenever there are any events which has happened and it causes a negative impact, is a issue. Is a negative impact is the risk. Risk associated with future event, it's called as a risk or an event. A risk which is already occurred and is considered as an issue or an event. Coming back to, since the whole quality team is always looks at data and analytics, and by doing the analysis, they'll decide about what is the risk, quantify the risk and all. In statistical term, the risk is often mapped to the probability of some events, which seems to be an undesirable, is a definition given by in statistics. Why it is so much important, why people are keep defining about it? There are many definitions of risk that may vary from specific application to a situational context. So risk is described both qualitatively and quantitatively. The qualitative risk may be a bit subjective, whereas the quantitative risk will always be an objective. There is also something called as, people talk about, the risk appetite is less. Yeah, you need to be a bit more risk averse, risk, and all those things. What is that risk appetite means? The amount and the type that an organization is prepared to seek and accept or tolerate is the risk appetite. How much you are capable of handling the pressure is another thing. Why it is so important today's context about managing the risk is, it affects each and every one. It can be at organization level, it can be a project, it can be reputation of your institution, it can be reputation of an individual. It can also be it can impact on your business. It can also impact your schedule. It impacts your scope of work, and whatever the level of quality and ultimately it may impact your profitability of an organization. And reduce the, what we need to do is, intent is increase the probability and increase the probability of positive effects is always is what we look at. Is at the same time we look at like, what we need to do and reduce the negative events. So that the principles of risk management is very well applied in the aviation, which we all look up to it. At the same time, it will be applied in healthcare industry, military space. Even like, I was going through a couple of videos, like, people do run the projects, like, be it be construction site, be it be event organization, be it be hotel management. The risk management principles, risk management strategies are applied across. What it translates is, it is a management of science. So management is nothing but like, application of all scientific information and use it in a much productive way is what the management is all about. The same similar line, the anticipation and the application of risk is across the healthcare industry. And why it is so important, predominantly why it is so important for a healthcare player like us. It can be an administrator, it can be the quality person, it can be the nurse, it can be anyone aspiring to be a risk managers. They need to know some of these basics, and there is a lot of career opportunities are also there in this line. As I said, like, in any management, the management definition of risk management is the identification, the assessment, and prioritization of risk. It can be positive, it can be negative, followed by coordination of an economically application of available, allocating the resources to minimize, to monitor, to control the probabilities or the impact of an unfortunate event, to maximize the realization of opportunity, is the gist of definition of risk management. And what are the components of risk management? The risk management is, first part is like, coming back to this, we need to identify the risks. What risks are there in the in any place we work? Suppose if we apply to our healthcare industry, first thing and fundamental thing in the healthcare risk management is identify the risk. Once you start identifying the risk, look at assess the risk based on like, some tools we can use as priority grades or assessment grades, risk severity scoring. All those things you're going to use and to prioritize the risks. And for all these things, you're going to, once you identify this set of the risks, what you will do is you allocate the resources. It can be technology, it can be infrastructure, it can be human resource, everything you allocate. And at the same time, you need to allocate your resources in an optimal way to minimize or to monitor or to control the probability or the impact of an unfortunate event. Yes, this is all about like, the negative side of the risks. Like, if it is a profitability, if it is, there is an opportunity of positive risk, is then again, it also helps in realizing the opportunities and maximizing your profits. Coming back to the basic principles of risk management, how one should go about it, but keep these things always fundamentally in your background. One is like, anything and everything what we do, we need to create a value. If you are not creating a value for any of our stakeholders, be it be our patients, be it be our investors, be it be our colleagues, if it is not helping the employees or to the stakeholders, it doesn't have any meaning in that. So that is what, like, anything when you are whenever you are doing a risk management things, like, this is something like, first and foremost thing is, what is the kind of value add we are giving to all the stakeholders. Any risk management things, principles you apply, it should be inclusive, like, and it should be an integral part of the organizational process. The organizational leadership should align to the organization's mission, visions, and the scope of work and the nature of work they're allocating, and be a part of decision making process. we need to share the feedback so that the management can take a good, productive, a useful decision making thing. At the same time, be a systematic and a structured way of looking at things. And it's, see, anything and everything in today's world we do talk about, it's all about transparency. It should be a fair deal for everyone. People know, what is that is been expected out of it, and what is my role in that. When we are all in a process of bringing change into the management, be a responsive to transform. So there has to be a transformational change need to happen. So be responsive to the change. Anything and everything we start, it should be continual improvement. It should enhance the scope of work what we do, and periodically you need to review it and reassess it. So with all these things in mind, your mind, with the background, if you approach any problem or a situation, you can able to handle it. So broadly, keep these things in your mind when you are applying your risk management strategies. The potential benefits of risk management are better decision making through a good understanding of the process. It can be a risk and its impacts. If you know the risk, if simple example, I would say a patient getting admitted in the hospital, a cardiac patients with an MI in the first 1 hour is an unstable patient. There's a likelihood of a cardiac arrest, or we may need to prepare ourselves, whether it's a required resources like crash cart, defibrillator, the trained resources are available around. So anticipating that, we're going to put a system in place. So the risk management certainly helps us in decreasing the surprises. And also, we need to effectively use the resources. Whatever the resources are available, we need to utilize optimally. Most important thing is, suppose a patient walks in with an acute MI, and he certainly looks up to all of us that one is they're all trained people. They know about what I'm going through. They anticipate what are the complications. Anticipating those complications, they are all going to put some systems and processes in place. They try to keep me in safe, and they try to keep me in safe hands. Similarly, that is the perspective coming from the patient. Whereas from the provider point of view, we know that we anticipate these are the complications. I'm keeping up. We going to put across, we treat the patient in a close monitoring in the ER, and then the patient goes to the cath lab where it is a controlled environment. Anesthetist or a trained cardiologist who are at the head end and side of the patients, and they do the procedure, and there can be a good outcomes. So if the stakeholders, the staff who are been involved in this process, if they are all aware of it, it can be a frontline staff, it can be the clinicians team, or it can be the governing board or the management persons. If they all know, we have such a kind of a robust system to mitigate the risk, they always looks at they are also been assured. So that's the reason these are a couple of benefits out of risk management. The steps of a risk management things are anything and everything starts with the plan of a risk management. Once you say we plan the risk management, the next thing comes across is we need to identify the risks. Once we identify the risk, we need to analyze those risks with respect to the impact, the probability, severity, and things like that. So then we need to plan to mitigate those risks. And once we have mitigated those risks, risks need to be continuously monitored and try to control the risks. So these are the main steps of risk management. Fine. So plan the risk management. When you're planning, it's always the question come across is how to do this and who will do it. So for these things, you all need to have a written down, as I said in my beginning of my presentation, it has to be a systematic structured process. When we're talking about systematic structured process, I need to identify the risk identification. and who is that person going to identify those risks. And we need to analyze the risk, we need to respond to the risks, and we need to monitor the risk. So all these things, someone need to do it. Who is that person? There has to be a responsible person with a clear-cut, defined job descriptions and knowledge level, and such persons only can do this job. So it is again, we need to bring a systematic, scientific way of approach with clear-cut deliverables, timelines, and action plans. Identification of risk. How do we identify the risks? So it's not just a one-man job. What we all talk about, like, as I said, it should be a systematic and methodological process. When we're doing it, more the barrier. People say that, like, when intellectuals come together, the society get benefited, like that. So you need to bring a lot of people onto the table and start discussing about like, identifying the risks. By doing so, it always has to be a group activity. It's not a single or a team activity. At least it has to be a group. The team should be like, a multidisciplinary team. Larger is always better. In any subject, you say, suppose we said, like, we discuss about the risks which are involved in the war. In the war, it is always good to have a surgeon or an anesthetist and the OT nurses, the biomedical engineer, the housekeeping staff, the engineering and maintenance team as subject experts. And then, of course, the management team, the customer, and other stakeholders can also be a part of it. So anything and everything we do, when we're even in the identification of risk also, you need to have a set of team members in that. Once the team comes across, like, keep doing a brainstorming exercise where started listing out the things. What are the events happened in the last 1 year or 2 year or 5 years? How frequently such instances are happening? What is the impact of it? Like that, based on our past historical data, dig the things what you have in your hand and start identifying the risks. And use the tools which are currently available. One is like, put a process. Very simple thing is putting a process flow. Putting a process flow is one thing, and another thing is like, we can put across a fishbone or a cause and effect diagrams, or like, a SWOT analysis is the most compromised tool where you look at, like, strength, weakness, opportunities, and threat of anything. Use your knowledge in identifying the risks in every aspect. If I start sitting here and looking at, like, and taking the entire flow of patients from the time of admission till the patients get discharged, or from the time of starting a unit to the commencement of a particular unit or a department, lot of things we can list down. If I take from project phase, one is like, setting up of the project from with respect to looking at your surrounding community needs, the infrastructure, the human resource, the checker maker mechanism what we're going to put in place. So everything need to be there, keeping the current safety standards in mind. Then once it has been done, you need to do a HFMEA to do assess, is there any risk in the process? Are we compliant to the regulatory requirements? Are we the technology and the infrastructure we are providing, it's up to the mark? So like that, you can keep on listing things. When you're opening a project, the main tool I would say to be used is, when you're opening a thing, do a SWOT. SWOT will give about strength, weaknesses, opportunities, and threats, so that, like, it can be used in a positive frame to improve their revenues. At the same time, when it comes to the patient point of view, when anyone comes into the hospital, what a patient expects, like, the ultimate outcome is a good customer satisfaction, a better clinical outcomes. At the end of the day, he need to go happy home. So I'll come back to those to the risk identification later on. So once we have identified the risk identification, we need to list down, put all the risks which are identified into a risk register that is called as risk register. List down all the risks. Next step is identify these risks are prioritized and an action plan is created to address this risk. Low priority items can be listed of the red flagged items may not be appropriate actions will be taken. But yes, whether it's a low hanging fruit or anything, like we need to list down, like uh, we may not take any actions, but thing is it has to be listed in your list. High priority items need to go rigorously analyze and mitigates and plan actions. A simple example of what uh, uh, just what I'll just share the list of I would say I'll share another application to share with you about identifying the risks. Second. An example to show you how to identify risks. See, in a hospital setup, you can list down key activities. Say, suppose an area like if I take all the staffs of emergency and list down the list of activities, what are the kind of risks they have? One is about there can be a fire, there can be a hazmat spill, there can be needle stick injury, there can be patient fall, there can be abuse of patients and employees, there can be patient assault, there can be a patient can abscond, there can be a suicide attempt, there can be a transfusion reactions. There can be communication barriers. People may not read back the errors, hospital associated infections, high alert medication errors, narcotic abuses, wrong side, wrong patients, anesthesia complaints, ER readmissions, delay in assessment of care as suddenly surge of patients. Due to the rush crowded ER, people may forget to take the consent, and patient can complain, employees can complain, the equipment's availability and their failure, complications of indoor induced labor and injury to the infant, child abduction, terrorist attack, radiation leak, discrepancy between the pre and post-operative diagnosis, patient confidentiality issues, electrical shock. So like that, you can list out. We have just listed about almost about 50 risks in the ER itself. So once you go to another areas, it can be ICUs, it can be ward, it can be the OT, cath lab, like all the areas across the hospital area wise, you can do a risk assessment. Once you have done the risk assessment, the next thing risk identification. Next thing what we need to do is we need to identify the once we have identified the risks in as a part of risk register, next thing is you need to act and analyze and act on that. So when you are analyzing a risk and acting on that, as I said, qualitative risk analysis and a quantitative risk analysis. When you talk about qualitative risk analysis, it is quick and easy to perform, and where a lot of subjective element comes into picture. When we talk about quantitative risk analysis, it is a detailed and time consuming one. It will be typically an analytical thing where expects a lot of monetary values, and we need to do a decision making tree and things like that to analyze the risks. I would like to take a very simple one here. An example, another example I would like to share. This is another example of simple way of looking at infection control risk assessment. Suppose, as I said, a lot of subjectivity comes here. It is not a detailed data-based assessment of a risk assessment. Simple example, if you ask anyone, like, hand hygiene is the major issue of likelihood of occurrence, like, the probability of hand hygiene is always could get a higher score of it will fall into a major category. Whereas single-use devices, people says, like, related infection, if you have a good CSSD and they are doing a good CSSD measure, there is never be an incident of where patient developing an infection following the use of single-use devices, but they may rate it as less likely. When it is coming to the blood culture contamination rate or central line infection, Foley's catheter infection, they all people will try to rate, like, and give them a moderate risk. Similarly, like, surgical care, surgical site infections, they may track it as a major risk. When coming to infectious disease, people talk about Acinetobacter and Pseudomonas, MRSA, and pulmonary tuberculosis. They rate it as all these things as a major risks. So against each of these, people do take corrective actions. Similarly, like, this is an example why I taken this one as an infection control risk assessment, to give a differentiation of perspective, where how a very simple subjective thing where individuals all come and sit and start analyzing and saying, like, a pulmonary tuberculosis or an H1N1 has got a highest risk, like, a surgical site infection has got a highest risk, whereas, like, documentation of this, all these things a moderate risk, which is true. And it's all it's all about a lot of subjective element comes into picture here. Another example I would like to share for quantitative. Okay, I'll use this. Yeah, all right. See, here you look at it. See, simple example of fire. You are trying to use the data of your previous occurrences. Probability can be likelihood of occurrence 0, 1, 2, and 3, where 0 is not applicable and 1 is low and 2 is moderate and 3 is high. And the severity risk into severity is the risk, right? So the probability and a human and an impact will be the risk. So what we always look at and calculate is, I would say, I'll take up the scores which are on the higher and then and try to explain here. See, look at these things, like of a transfusion reaction happening in the ER. Reason because it can be there is a moderate risk. A patient comes into ER and cross matching has been done, and ER is being a crowded place. There will be a probability of likelihood of happening will be a moderate. If at all, if it happens, there may be a possibility of a death. It can happen, right? Reaction happening for a blood transfusion in the ER, there is high likely chances of anyone's death. When it comes to property impact, there is no much property impact happening with respect to blood transfusion reaction. Business impact may not be, like, yes, to some extent I can accept it, but thing is, I would say, like, let it be at this point of time, it's not applicable in the interest. Then multiplying probability with the transfusion reaction, and the next thing is about the preparedness level, the internal responses, the external responses. We get the score of about 22, which is of a relatively high risk where you need to act on it. Why I'm sharing this is, look at the quantification of data which is happening from the subjectivity into the numbers. By doing subjectivity to the numbers, you are quantitating. When you're all sitting and deliberating and discussing on the whole thing, we would like to again, he said, anesthesia related complications, wrong side, wrong surgery if it happens. So these are the high end high risk things which you need to put your act together to mitigate those risks. So that is an example of quantifying the risks of and we are doing a risk analysis of I didn't share, is it? Okay, sorry. I want to share. Quickly show that once again, otherwise yeah. So this is an example of quantification of risk with respect to probability, impact, prior property damage, business, the mitigations principles, and the risk score. So use this, have an acceptable threshold of a risk score, and then wherever the score more than 12, you need to have some actionable plan to mitigate those risks. Yes, I'll stop this sharing. I'll come back to the presentation. So once we have analyzed the risk, you need to take corrective actions which are required, right? So when we quantify the risk into 2x2 thing about where impact is on the x-axis and probability is on the y-axis. So impact and probability, which is always the right upper quadrant, which is on the outer side, it is a high impact and high probability. Like simple example is the anesthesia complication, the transfusion reactions, or surgical site, wrong surgery. Such kind of things need to be addressed immediately, and you need to put across some systems in place so that we should mitigate such kind of things. Whereas low impact, high probability, high impact and low probability, in all these things you need to take corrective steps to mitigate the risks. Whereas low impact and low probability, it's all, yes, these things are low hanging, but still you can look up to things and say you can still live with that. Most important thing is coming back to the risk response and the plan what one need to make. As we are keep talking about the risks, there are about two types of risk, a negative risk and a positive risk. What kind of an action plan you need to make and how it should be made. So the risk response plan strategies are always on four things on both this side as well as on that side. One thing is you avoid a simple thing. I would say, given a typical example, today's world, people talking about minimal access cardiac surgery. It is a newer thing, newer technique, or a robotic surgery. It's a newer thing, newer technique. At the same time, I'm not trained, I'm not certain, the likely outcome of chances is not so great. Why a surgeon need to take that risk? He can very well avoid that risk. So whatever the components of we are talking about negative risk, the first thing coming across is the avoid. If you are a trained expert, the best and foremost thing is avoid. That's fine. Then adopt a proven approach instead of trying and doing an experiment. So that is, instead of doing a new approach, that is one thing. or improve your effective communication in your team and set expectations with the customers, and or acquire an expert, like suppose someone is doing someone is already trained, get such guy rather than you yourself experimenting it. But having said that, keeping things in mind, one need to take risk to move ahead. If you're not taking the aggressive steps, you are not there. You'll be, if you'll be like, that's what the people talk about, assertive and all those kind of things. uh, I would say in this thing is in this current context, we need to adopt, we need to take risk, and we need to move on. But in the course of journey, people need to make efforts to overcome those risks by putting some systems or getting themselves trained, or getting an expert. There can be some amount of learning curve, but be prepared for handling all the complications when you are adopting a new technology, or doing a new procedure. At the same time, end of the day, patient safety matters. Other things, mitigations, like risk mitigations is what, like majority of the work what we all do in today's healthcare setting is all about, like risk mitigation. Most of the things, like if you take any process, I would say simple example is, we all know patients do die in the hospital. To mitigate that first risk, people look at is whether you have a resuscitation team. Next thing people ask is whether you have a resuscitation resources. After that, people will ask, like whether those resources are trained. That is one part of it. When you talk about, like anesthesia and anesthesia related complications, the same thing, whether you do a pre-assessment, during, you categorize the risk of anesthesia, and knowing the risks, benefits and the complications and the outcome of the procedure. Are you sharing the information with the patients and family, and you are taking the informed consent? And after taking the informed consent, are you continuously monitoring the patients during the procedure, post procedure? And who the person is going to give anesthesia, whether is a trained person, is credentialed, privileged to do so, and keep a watch on monitoring his outcomes. All these things we do with respect to anesthesia safety. Similarly, when you talk about surgical safety, here also the same thing, to prevent wrong surgery, what we will do, first part is, like we do a surgical site marking. We involve the patient to participate in their care process. When the patient is get involved in participating in the care process, we try to do the surgical site marking. After doing the site marking, we also explain the patient about what procedure you're going to undergo, like whether you're undergoing right side TKR, means, like right total knee replacements. And then again, they also we are talking about risk, benefits, and probable alternatives. You give the choice to the patients, and then, like see, predominantly this, particularly this consenting process, will take into the next step of where you are passing on you are transferring the negative risks to someone else. Whereas in the mitigation strategy, what are the checks and balances you are placing in? The checks and balances, similarly in our case, what happens is, once the patient has comes into this and decided this patient has to undergo a surgery, there will be an initial assessment by the surgeon, and he decides, like what sides he is going to do, and they will participate the patients and family in the process. Then do the surgical site marking, involve the patients and family in the decision making process. After involving them in the decision making process, the patient need to be shifted to the OT. There is a checklist which need to be ticked by the nursing team. In that, they again look at, like surgical site marking, consent. Without surgical site marking and consent form, patients been never been shifted to the OR. And similarly, the OR nurse never receives the patient without surgical site marking and the consent forms being if it is incomplete. So that is a kind of empowerment, like what one need to do to in mitigation strategies. The last and final check, like you put across there is a ward assessment is there's a pre-operative checklist is one thing. Without consent form and without surgical site marking, people won't accept in the theater. That's another thing. The last and the final thing is on the OT table, we all do the timeout. So look at the things. There are 3 layers to mitigate the risk of wrong side, wrong surgery doing. Like that, each and every process what we design and develop in the healthcare, we keep on building like layer or layer to mitigate those risks. So that is, as I said, like this process is all about additional checks. Coming to about transfer of the risk. Yeah, it's very simple. What we all do is we transfer the risk to a third party. The third party transfer means, yes, there is if I make a mistake, there is a mistake happens, like at the end, like any risk mitigation will boils down to ends into a dollar value will be tagged to that. When people attach a dollar value to that, it is our responsibility to look at like benefit ratio, how much premium I'm going to pay to cover myself or secure myself with the insurance, to how much money will go. So typically people will make it makes typically a business sense for us to invest on an insurance and pass on our mistakes. We are not immune, like errors can happen, but the point here is how to own that mistakes. And once you own that mistake, like you are certainly like you need to pass on the risk, some dollar value to the customers. To that, who's going to take that risk and who will going to fund that? So for that, we go with the third party insurance. Similarly, for equipments, we may go with the comprehensive annual maintenance contract, or we may go with the warranty. All these things means basically what it talks about is transferring your risks to some other person, transferring your risk to your insurance, transferring your risk to the patient by involving patients and family in the consenting process and decision making process, and taking the equipments and things into warranty and AIIMS. These are a couple of examples of how to transferring to the third party. Acceptance. So sometimes we accept the risk if no actions are feasible. If the probability and the impact is too small, we do accept. There is something called as an acceptance. In the acceptance, there are 2 types. One is a passive acceptance and an active acceptance. Passive acceptance is there is no plan. Active acceptance is always like there is a contingency plan. There is an equipment is going to likely to break down, which we are aware of it. Yeah. So what we do is we always make a contingency plan. We'll keep there are 2 biochemistry analyzers, and every equipment will go. What is the backup for this? And what is the backup for this? What is the other alternative mechanism? If the staff goes on strike, like what is your contingency plan? Like, or similarly, if the doctor didn't turn up, like who is the plan B? So like that, we keep looking for a contingency things. So at the end of the day, when you accept the risks, like needle stick injuries too can happen, we need to monitor those risks. Coming back to positive risk, it is all like exploit, enhance, and share and accept. Ultimately, all these 4 elements of positive risk response plan is all about like utilizing those opportunities and translate those opportunities into revenue and profitability. So I'm not going to talk much about the positive risk, which is our day in day out. Like when we are there in the healthcare business, we keep doing. We know that yes, if you put across a good infrastructure, there's a billion population is in of this country. It is who needs a healthcare. people do come. And next thing is, if you keep providing them, keep servicing them, your revenue is certainly going to improve. And knowing that there's a positive risk means accept it and cash on it. So that is all about positive risk management. Coming back to the next thing is, you have uh, you have identified the risk, you made a risk registry, you did a risk analysis, you quantified the risks into qualitative and quantitative, you made the break out the whole thing, you analyze the risks into based on the analytical score, and then you put across the plans to mitigate those risks. And once all this risk things has been taken care, it needs to be continuously monitor, regular review of the identified risk, and ensure that they are still relevant. Still relevant is most important word I would like to say. You can't say that, sir, last 1 year that instance has not happened, let me not put into the risk. No, always history repeats. So the same story holds good here. You always, it still makes relevant to list it down into the risk and continuously monitor. The next thing is risk audits to be conducted to ensure that the plan what you have been implemented or the or things are in place. Today's world, why are we all going for accreditation? We all go for a third party accreditation with a simple thing, whether it is JCI or NABH or NABL, any of these things, they go and audit checks, looks at your checks and balances, they audit your processes, they look for your contingencies, they look at how the institution has been safeguarded, how the patients have been safeguarded, how the employees' safety has been in mind. So all the aspects they will certainly keep in mind, and the risks audits are conducted to ensure that the plans have been implemented and are effective. Yes, when you are in the monitoring thing or in the control phase, we are always see surprises. As I said, unexpected risks do happen, but not identifying which. Yes, this though we have such a robust plan, the entire team sat and identifying the risk and all, but still sudden something as unexpected risk has happened means it indicates that during when you are listing it down, you forgot to list that down. That is the reason an unexpected risk has been occurred. So not identified during the risk identification. So these are the broad basic principles of risk management. A1 is the identifying the risks, make the analysis and corrective action based on the risk, and then we talk about risk mitigation strategies. Then we talk about monitoring and controlling of the risk. This is all about the basics of risk management. Of course, I would like to share a couple of things when it comes to medication management process. We do HVA, hazard vulnerability assessment, and then put across a score towards that, do a FMA, do a fishbone or a SWAT. So all these things are tools to mitigate, to identify and mitigate the risk mitigation strategies. At the same time, and anything and everything we do, there has to be an improvement in what we have done. We need to closely monitor the risk register. At the same time, it can be see, there is no severe adverse anesthesia events. People say, yes, there is no severe adverse anesthesia events in the hospital. Reason because you have got a qualified anesthetist, better machines, better technique of delivery of anesthesia. There's a good monitoring process in place during the entire phase, pre, during, post, and your outcomes are good. So why do we need to monitor? In the last 3-4 years, there is no adverse anesthesia event like that. Don't ever ignore it. We may come across sudden overdosage of anesthesia. We may lose in one's life. So keep this thing active. As I said, it is very important topic. It is important for everyone. In the today's context, people, they are all moving from the risk management of patient care related things to or a business process related things to an enterprise risk management role. So there is a lot of scope. People need to go and learn the advances in strategies, advanced strategies in the risk management. This is what, like, I dealt. I didn't touch upon the decision making tree, the statistical things, which are all I undo things. But the basics things, what I try to approach from basic identification to monitoring to analyze to take corrective actions to control and keep the risk at always at the lower level.